Cohort 13. Hi, it's Miss H here with another video to entertain you and keep you focused, keep you busy, keep you on task so that you can become the wonderful dental hygienists that are going to change the future of dental hygiene. Anyway, today I'm going to show you a little bit about a finger rest or the fulcrum. The fulcrum is the fourth finger, whether you're right-handed or whether you're left-handed, okay? The fourth finger. All right, so the fourth finger is what keeps your hand stabilized in the mouth. Without the fourth finger on a tooth, or whether you're doing an extraoral fulcrum, which eventually we'll learn to do so, like maybe on the outside, extraoral like this a little bit with cheeks coming around, something like this. Or something like this. Sometimes we'll do that, but we're not going to be learning that until later on. Right now, we're going to just be learning basic intraoral fulcrums, which means that you have to fulcrum on a tooth, okay? You want to fulcrum on the same arch, typically, unless there's no other way for you to do it, but I'd like for you to try to start to learn it by fulcruming on the same arch. So if you're going to work on the lower right sextant or quadrant, then you want to stay fulcrum on that precise quadrant, okay? You don't want to be fulcrum over here and work over here, because what's going to happen is those fingers are going to split, and that's always going to be a no-no, okay? So you don't want to fulcrum on an opposite arch and then be working on this arch, because what happens then is then your fingers are going to split, and that's not acceptable. All right, so remember, hands always are going to work together as a unit. Fingers don't split, fingers don't do the work. What does the work is our wrist. Okay, all right, so for the basics of learning a fulcrum, we want you to kind of keep this in mind. And let me give you an example on the lower right. And of course, this is going to apt to change a little bit depending on your ability to gain access and the size of your hands and your patient, and if your patient's missing teeth. There's a lot of variables that can go into this. But typically on a typodont with a full-scale dentition like this one, we're going to say that if you're working on the facial, working on the facial, the buccal, okay, of the posteriors, you're typically going to fulcrum on the lingual of that same arch. So if I'm working on the buccal of 30, I'm going to be fulcrumed on the lingual of 30, okay? And so, of course, I'm going to have my cheeks here, and then you're going to have your mirror for retraction, okay? If I'm working on the buccal of 19 or 18, then my position's also going to change, but I'm going to find that my fulcrum is going to be a little bit more towards the lingual, so that I can get in here, and I'll have my patient come around here a little bit more so that I can get in here and stand up a little bit more towards my lingual and approach it from this surface, okay? I have the wrong end of the Explorer, okay? There we go. If I'm going to be working on the buccal of 19 and 30, 19, on the lingual of 19, then my fulcrum's going to be at or around the buccal of that surface, okay? If I'm working on the anteriors, I'm always going to be fulcrum on the incisal edge, okay? Whether it's the facial I'm working on or the lingual that I'm working on, okay? The same goes true for the maxillary. If I'm going to be working on the buccal of number 1, 2, or 3, then my fulcrum's going to come on the lingual of 1, 2, and 3. Okay? So that's just kind of some basic rules to follow. And again, if you follow your book, your Neal book, and you look at it and start categorizing, and my suggestion would be perhaps for you to make yourself a little list, like lower right sextant, number 31, 28, 29, 30, 31, 32. And if you're going to work on the buccal, then where would you fulcrum, that kind of thing. And then make yourself some notes as to clock positions as well. So just remember that your fulcrum finger always wants to stand, you always want to stand up on your fulcrum finger. Okay, you don't want to have what we call a lazy fulcrum, because when you have a lazy fulcrum, your whole hand is going to lay down and you're not going to be able to activate that and be in a neutral position. So you want your fulcrum finger to stand straight up. You want to stay between the second and third joint, and you want to be able to activate that. And as you see, I'm working on the lingual, but I'm fulcrumed on the buccal to make that work. Okay? So I want you to practice this as you go around on the different sextants in the mouth, and see what you think about that, and we'll talk about that tomorrow when we have class.